Did you know there's something you can do after a heart attack that actually increases your chances of feeling better and living longer? It also reduces your chances of future cardiac problems. It's called cardiac rehabilitation. Think of it as a sort of customized exercise and education program with a team of health professionals to help you recover after a heart attack or after surgery for heart disease. Catherine Calloway has more on this.
A few months ago, Rick Muska's heart condition would have made this kind of workout difficult.
I had previously had a pacemaker put in, and that was supposed to give me a full return to normal life. And then I get followed up with a heart attack instead. I just didn't have confidence to get out of a chair and do anything other than sit there and watch TV all day. And I knew that wasn't the thing to do. So my doctor heard my tale of woe and suggested that I start a cardio rehab.
Muska headed to DeKalb Medical's Wellness Center, where a team of health professionals that includes doctors, nurses, physical therapists, and dietitians tailored a cardio rehab program of diet and exercise to fit his needs. Cardiologist Sandeep Chandra has seen a dramatic improvement in his patients who stick with the rehab program.
We found that patients who get enrolled in cardiac rehab, they tend to live a lot longer. The risk of having a second heart attack is a lot lower. And the risk of dying is about almost a quarter of what it was before the rehab.
Muska knew the benefits, but was still nervous about starting the exercises. He was comforted by the heart monitor that he wears while working out, as well as the counsel and close supervision of the staff. Just a few weeks into rehab, he noticed his stamina had increased.
And so I said, well, you know, let me try moving things up a bit, adding more time to the exercises and a little more speed. And once I started really exerting myself, I got better a lot faster.
Dr. Chandra says cardio rehab is often prescribed for people who have had a heart attack, but people with many types of heart or blood vessel disease can also benefit from the rehab.
The rehab prescription, just like medication, is very specific to the patients, and some of it depends on their ability and what their previous experience with exercising was. And it can include a combination of either just walking, maybe a little bit of stretching.
Dr. Chandra says only about 10% of patients with conditions that would improve with cardio rehab actually take part in the program. And he suggests heart patients ask their physicians if they're candidates. Like Muska, they could end up with a lifestyle better than before they had their heart attack.
There's no use just going home and sitting there. That's not living. So as long as you keep moving and can do the things you want to do, that's what my goal is.
Catherine Calloway, Accent Health.
Many insurance companies are going to cover your cardiac rehab. That's the good news. Medicare is also going to pay for people with certain heart problems. If you think you're a candidate, discuss this with your doctor. If your doctor suggests taking part in a cardiac rehab program, remember this: the longer you stick with it, the greater the benefits.